out there through the British Association of Art Therapists, which we can use to kind of get a better understanding of art therapy today. So you still get case experience, just not necessarily mine. So because this is online, instead of doing questions throughout, because I can't see you and it's going to be hard to know who's talking, we've got some time for questions at the end, and I'll kind of show myself then and you can come off mute. Also, just so you're aware, this presentation is being recorded, but the recording is going to stop when we get to the questions and answers, just to respect everybody's privacy. So I'll let you know when we get to the point that the recording will be stopped as well. So again, you're going to be muted during the presentation as well. And if for any reason we lose signal or Wi-Fi, that doesn't normally happen for me, but if we do, I'll just reconnect and join the meeting as soon as possible. So there might just be a minute delay. And I guess normally I would say phones off and know where your fire exits are, but I'm guessing you're all at home and you know where your front door is, so bear that in mind. Okay, so I guess aside from this, we'll start. Okay, so what is art therapy? So Adrian Hill was an artist who worked with people recuperating from tuberculosis. He found that patients were able to use the artwork to express anxiety and trauma. From this, art therapy has become a form of psychotherapy where art is used as a mode of expression and communication. So art therapy also can be used as art psychotherapy or as art therapy. It's interchangeable depending on what the art therapist prefers. So I tend to call myself more of an art therapist than an art psychotherapist, but it depends where the professional wants the emphasis to be. Some people prefer to say art psychotherapy, so that it's kind of more attached to that, but I'm quite flexible, but through my accreditation, I'm allowed to call myself either. So art therapy is a way to work with uncomfortable experiences through imagery. It's a non-threatening method to explore thoughts, feelings, and identity without the pressure to talk, without having to use verbal communication. Unconscious emotions may emerge through the artwork in a concrete manner, so you've really got something in front of you, and the artworks then become a permanent and tangible record of your feelings. And by the art therapist accepting the image's content, the clients can then gain a sense of validation and support from the therapist by being accepted in the relationship. This poster here just kind of captures some common misconceptions or misunderstandings of art therapy. I think especially when adults hear about it and they've maybe had a kind of a difficult relationship with art making at school. This is just kind of a poster which really shows what the difference is. I'll just give you a minute to take a look at that before I move on. Okay. So art therapists practice on an individual basis, so in one-to-one art therapy sessions, or in different variations of art therapy groups. So I guess some of the different variations might be a closed group, which is when it sets people, patients who are referred to it, so then it would be closed just for those people. Or there might be an open art therapy studio, which is more of a drop-in, less kind of set for specific people. I'm just hearing someone, 1 second. Sorry, I'm just muting people. Just a bit of background. So the aim of art therapy varies per client, depending on the reason for referral, depending maybe on their diagnosis or their age. But regardless of that, art therapy provides a non-judgmental space, a sense of freedom for the client, and a space for creative expression.
Sorry to interrupt you. Are you happy to admit someone now?
Yeah. Thank you. Okay. I'm just going to carry on for whoever's just joined, and we can come back to questions at the end if there's anything. Okay, so then art therapy also provides a confidential space, a space for someone to be quite playful, to kind of bring out something that maybe they've not brought out in themselves for a while. And one of the main things is it creates a therapeutic relationship. So in the very first art therapy session, the art therapist has a whole load of art materials, and they would introduce the client to what's there for them to use. The boundaries of the session are explained, so the time, how long we have, how many sessions you're going to have with that person. And then you would explain the confidentiality and the storing of the artwork. So in terms of confidentiality, I always say to people that I work with that everything that is said or made within the sessions just remains between us, unless there is anything specific that I'm worried about with regards to their own safety, their own risk, or the risk of others. And where I'll come to where I work in a bit, but at the moment I'm working on an inpatient unit. So confidentiality also has to bear in mind the risk of the unit as a whole, and there might be more people that need to be informed of certain things going on for the patient because of the nature of the setting. But generally, everything that needs to be stayed between us is stayed between us and the patient. And the artworks and images made in the sessions are safely stored by the art therapist, again, because what they make is also confidential. So doing so by keeping the artwork and looking after the client's artwork, the images can be brought back out for further reflection in different sessions so that you can kind of review a real catalogue or a collection of what someone's made. So for example, I've been working with someone for a year. That's like a lot of artwork to then go through and have a look at and review, and you've got something concrete which can kind of show a patient's progress, any changes, any events that have come up with them through what they've made that can then be kind of gone through and looked at again with a patient. And the artworks themselves can often act as a symbol or talisman which holds feelings. It can be quite embodied. That means that the images need to be respected by everyone in a group or within individual sessions. So there aren't that many rules to art therapy that I would say to patients. The only rules are really that you're not to hurt yourself, not to hurt the therapist, not to hurt the room, and not to hurt the materials, which also in a group includes one person not rubbishing. So by rubbishing, I mean criticizing, commenting on what somebody else has made, and not touching what somebody else has made without asking, for fear that it could be broken in some way. So with regards to in the sessions themselves, I work in a non-directive approach where clients are invited to use whichever materials they like in whichever way that they like. And it really then becomes their space and their time, kind of coming back to that real sense of freedom and control that they have over their own sessions, as they are for them. And although I predominantly work non-directively, art can be challenging and the clients may struggle to know what to make. I mean, I, for myself, know that staring at a white bit of paper can be really intimidating, and it can be hard to know what to make. So in that case, I might encourage them if needed, might help with a theme or introduce a specific material. So a theme, for example, might be to make an image about your name, put your name on it somewhere. Make yourself as an animal. It could be introduce yourself through your artwork today. Or is there any specific event or feeling that you'd like to express in your image? Something from your week that you'd like to share? Or I could just say to someone, have fun with the materials. And there's this phrase that one of my lecturers said to me, which I've become quite attached to, which is take a line for a walk. Just pick up the pen and take it for a walk across the page. Oh, sorry, overskipped. Some clients prefer to remain silent and focus on the artworks alone in sessions, choosing not to share anything about what they've made with the art therapist. Where a client remains non-verbal, the art becomes the main source of communication for the client, between the client and the art therapist. And at times like this, the art therapist may also choose to make art alongside the client, depending on whether the therapist feels that this might be a helpful non-verbal interaction with the client. So this is something that I might do depending on who I'm working with. So for example, if I was working with a patient with paranoid schizophrenia, which I do in my work at the moment, it can often be quite grounding for the art therapist and the patient to be working at the same time. It shows that you're both seeing something in front of you. It's very concrete and it's very real in this moment. And it could be quite a way to bring someone back if they're having any delusional thoughts or any paranoia in that moment. It means you can kind of bring it back to the artwork and really see what's in front of you to kind of talk about and bring them back to the present. I'm often quite silent during clients' art making, unless they narrate aloud, kind of really telling me exactly what they're doing as they're making it, kind of I'm taking this pen, I'm doing this, or unless they engage me in conversation. Choosing to allow them to focus on their making and to then have reflection time at the end. My active or passiveness varies depending on what I feel the client might need from me. So for example, I try to be more active in encouraging reflection of the images and the session at the end, if they've not spoken much throughout. I kind of wonder aloud about their images, kind of making these comments or open questions to see if we can explore what they've made and make it more exploratory. So I might say things like, how do you feel about your image? If you could change your picture in some way, what would you do? If you had to give your picture a name, what would you call it? Does your image remind you of anything? Do you even like what you've made? Or I might be a little bit more metaphoric and say, if they've maybe drawn a landscape or a place, I might say, if you were in your image, where would you put yourself? Who would you take with you? What would you do there? And if they drew a person or an animal, I could say to them, if you were there, what would you say to them? What would the character say if they then spoke back to you? What kind of conversation would you have? So these kind of quite fantasy-based questions, maybe more explorative and playful, can often bring up a dialogue about what is going on for the patient or client, in a more exploratory way. And it could be less intrusive. So I just want to talk a little bit about how I became an art therapist, or how you become an art therapist. So we've got a bit of a timeline here. So after I finished secondary school, I spent a year studying art at Bezalel Academy of Art and Design in Jerusalem. Whilst I was studying there, I was participating and facilitating in art workshops voluntarily with the elderly at Yad Lakashish, which means Lifeline for the Old. And I was also volunteering with children and expectant mothers at Hadassah Hospital, Mount Scopus. This is when I first started to think about a career using art therapeutically. And based on that concept, I then started to realize that there was a profession called art therapy. So after being in Israel for the year, I came back and I started studying fine art at Nottingham Trent University. Again, while I was studying, I continued to volunteer. I ran a therapeutic art pilot project at an elderly care home, and volunteering with Headway Nottingham, which is the Brain Injury Association, kind of helping with their pottery classes and doing art workshops with them. After completing my degree in fine arts, I started the 2-year full-time master's course in art therapy at the University of Hertfordshire. So you have to have the master's in the UK to go ahead to get the accreditation to call yourself an art therapist. And you could either do that on the full-time course or you can do the part-time course. So 2-year full-time meant 2 days at university and 2 days on a placement as a trainee art therapist. So they were clinical placements, really working, having your own individual sessions, your own caseload, and just with the support of the university and a placement supervisor. So for those placements, for my first year, I was working in mainstream education in Hackney. And as part of that, we ran a art therapy group for reception and year 1 children on self-esteem and confidence building. And actually, we had a great achievement in that group in that there was a selected mute girl who started it, and by the end she actually started talking. So that was great that she was kind of able to benefit from the group. And for my second year placement, I was working for, it was originally called North Essex NHS Trust, but now it's just Essex as a whole. And I worked in adult mental health. This was a community mental health team, which is like an outpatient service. And I also worked at a male-only low secure inpatient unit. So for those that aren't aware, a low secure inpatient unit means that most of the patients are under a mental health section, so that they are in hospital to receive treatment that they wouldn't be able to get anywhere else, and that they need to be in hospital because they are either unsafe to themselves or unsafe to the community. And it's because this was low secure, it was often the case that they were more risky, to people in the community, and they could have come down from a forensic route. And as part of the course and part of the masters, you wrote a clinical case study, which is very similar to dissertation. So my study from the work at the low secure unit that I was just talking about is actually going to be published in a book chapter next year on art therapies for sexual offending. So it really shows that although I was a student, that was really, really rich experience for me. So after graduating from the University of Hertfordshire, as I mentioned earlier, being an art therapist in the UK is a protected title. So you kind of really need to do the masters and to be accredited with HCPC, which is Health and Care Professions Council, which is where psychologists are accredited, nurses, dentistry. It's the professional body really that regulates, checks that everyone's working safely. And there's also the British Association of Art Therapists, where they kind of write all the policies and the guidelines and offer special interest groups and CPD events for art therapists in the UK. So the first few years of my employed work, as you can see here, was a mixture of working self-employed part-time and employed part-time positions, which is very common for art therapists. It could be that you are working for multiple companies in 1 week. So at one point I did have 3 at one time, but then it changed to just having 2 before I now have the 1. But also since studying art in Nottingham, I have continued to develop my art practice and exhibited internationally and in the UK, because I find that continuing this practice alongside my art therapy work is really beneficial to reflect on my clinical experience and also just my own self-care and my own interest. I'm just going to go through now and talk a little bit about the work that I've done there. So for Hertfordshire County Council, it's actually an organisation called Safe Space, which is a charity within Hertfordshire County Council, and it's a counselling in schools service. So a lot of this work is funded through pupil premium, which is a funding to do with schools. So I worked in primary schools, secondary schools and colleges. And I was essentially a lone worker, which meant that I had my suitcase full of all my art materials, and I had the patient's artwork in one hand and was going from school to school, and I kind of called myself a bit of a travelling art therapist. So that meant that I had to liaise quite closely with SENCOs. For those who aren't familiar, that's Special Educational Needs Coordinators, which are in most schools in the UK, which help kind of do anything to do with pupils' well-being and any pastoral support that they need. So the work with Safe Space was quite time limited. So I would see, it was mainly individual work as well, individual sessions. And I saw from the age of 3 to 18. But yeah, so it's time limited. So it's between 6 sessions to start or 12 sessions to start, which is, you understand, it's quite small amounts. But depending on the funding, it could go on for longer. So there were a few cases where I was working with someone for over a year because of the nature of why I was seeing them. But as it says here, it's quite a mixed reasons for referral of why I would see these children. So I saw children with ASD, so autism spectrum disorder. I saw LAC children, which is looked after children. So that means that they were either in care at the time that I saw them, or they were in an emergency foster care placement, or they'd recently been adopted and had just left care. I also work with young carers. For those who don't know, a young carer is someone who is got a caring role for a parent or grandparent within their family. And that could be to do with physical health or mental health caring role that they have. I also work with bereavement. So that was either bereaved through unexpected death, so for example, through suicide, or through something a bit more expected. And as it was to do with Hertfordshire County Council, there was close network to do with the police as well. So that did mean that we worked with children who had experienced abuse themselves or had witnessed it in the family home. That was sexual abuse, there was physical abuse, and there was also children who had experienced neglect that we worked with. And I worked with this company for as soon as I graduated. And I originally was working there 4 days a week, but as I started to get other work, I kind of went down to 2 days. But it was like 5 children a day, which meant I could have been in 5 schools in one day as well, and that was across Hertfordshire. So I did some brief work for Haven House Children's Hospice, which is very close to home. And this was a pilot project where I ran an art therapy group for pre-bereaved siblings. And also did some one-to-one art therapy for teenagers with cancer, so the oncology referrals. Then I started an employed position at St. Francis Hospice, and my title was technically child and family therapist, but I was mainly working as an art therapist. So unlike my other positions, this was funded through BBC Children in Need. And I worked with pre-bereaved and bereaved children and families, so they just needed to have a relative that was known to the hospice for me to work with them. And again, like the work for Safe Space, I was kind of traveling art therapist with my suitcase, going to primary schools, secondary schools, seeing children at the hospice and in their home. And it would be the case that we would follow someone from pre-bereaved all the way into bereaved, depending on the situation. And there were times, because there was an inpatient unit, where myself and my colleague Stella, who's photographed with me, would get called to speak to a parent or a grandparent about how to have difficult conversations with the children. So maybe explaining that someone is going to be dying, or that someone has died, what language that they should be using. So as part of that role, we set up an art therapy group for bereaved children after school. And with the strong connection to bereavement work, myself and my colleague Stella also were able to facilitate training to local schools on putting up bereavement plans and how to communicate about loss, and also for other companies as well, if they experience a death even within the staff team, or within a child or on a school trip or something like that. We kind of did a training on how to communicate it and the theory behind loss and bereavement. So in my current role, so I've been at Vision Mental Health Care since December 2018, and this is a full-time 5-day-a-week position. And I'm there as an art therapist. So this is a bit different to my other work in that it's a adult mental health inpatient unit. So it's a 24-bed unit and just needs to be over the age of 18. So you can see a picture here, actually, this is of the communal lounge. So from the outside, it really just looks like a really big house. I believe it used to be a convent back in the day. But yes, it's a really big house, beautiful gardens, and this is just one of the main communal lounges there. But so the majority of the patients are, as I mentioned earlier, sectioned under the Mental Health Act. However, there are a few voluntary patients, which we call informal patients. And the average stay there is around 18 months, dependent on the level of risk of the patient. But we do have some who have been there more long term, so 5 to 10 years. But it depends on the best interest of the patient. And it is a rehabilitation unit, so it's kind of the main aim is that this is the last admission that a patient would have before being discharged to the community. So it's got mixed diagnosis. So there's a recovery stream and there's also a personality disorder stream. So that means there's patients with paranoid schizophrenia and emotionally unstable personality disorder, which you may have heard of as borderline personality disorder. They're the same thing, really. It's just more fashionable at the moment for everyone to call it emotionally unstable personality disorder. I think it's more European. But for those who are not aware of what that diagnosis means, it means that these patients often have unstable relationships, quite impulsive behaviour, maladaptive coping strategies, so they self-harm, they have suicidal ideation, and they're quite emotionally unstable with real intense emotions, and it's hard for them to regulate their emotions. So one of the main things that drew me to this role was they have something called mentalization-based therapy, MBT, which is founded at the Anna Freud Centre in London, and it's one of the few evidence-based therapies for patients with personality disorder. So as part of this role, I work both as an art therapist and as an MBT therapist, which I was able to go on the training last March. So because of that, I facilitate both individual and group art therapy, and I do group and individual MBT. And I've also combined the two to create mentalization-based art therapy, and that's both in a group and in individual sessions. And some of these groups are more therapeutic, whereas some of them are psychoeducational. And there's also groups which are facilitated in the community. So although, for those who are not aware of the process, although they are sections, they mainly need to stay in the unit. The psychiatrist, who's the responsible clinician, can grant what's called Section 17 leave, so that they can have leave from the hospital to access something in the community. So we do some groups in the community. So again, as I mentioned at the beginning, as I'm not sharing my own clinical experiences, I wanted to share with you some children's comments on how art therapy has helped them, and these were taken from an art therapist who is a member of the British Association of Art Therapy, which I'm a member of. So as we can see on the left, this child, age 11, she said that art therapy has helped me express myself. I'm able to take out my stress using different art materials. I worry less now and have learned ways to cope and deal with my anger. I know that I can cope by myself. Without art therapy, I'd probably still be worried and stressed. And then we have on the right, child age 9. If you're angry or sad, then art therapy can make you feel happy. Making art and speaking to my therapist calms me down, and together we work on options to help with friendship problems. This is just a nice way to kind of get their view on it. So next, I'm going to show you a video. It's a form of research, again, by the British Association of Art Therapists. It's called an audio image recording. So what we're going to see is a patient artwork, and she's going to be talking over the artwork with the art therapist that she worked with, and they're really going to be kind of discussing what happened. So here we have Claire. I believe that's not her real name, but we have Claire, who reflects on her experience of art therapy, adolescent trauma, and emotional dysregulation, which is similar to borderline personality disorder. So at the age of 17, Claire accessed art therapy for approximately 9 months. Claire started art therapy with a community CAMS service. CAMS is Children, Adolescent Mental Health Service, after she was discharged from several consecutive inpatient units. So what I'm going to be showing is quite similar actually to the work that I do in my current role. If anyone, for any reason, would prefer not to listen to this video, it'll be about 6 minutes if you kind of want to join back after. But I'm going to start that now.
So can you say a few words about how you were when you started art therapy?
I just come out of hospital and I was on a high, but I was expecting to crash, and I still hadn't sorted through a lot of the mess in my head, and I was still experiencing quite strong emotions, and I didn't really know how to deal with them because I was on such a high.
Can you say something about the first piece that you've chosen?
I was very angry when I did this piece, angry at life and family and circumstances, so I just started painting with my fingers, and it turned into this. It was a good way to get my emotions out.
At what point in the therapy did you make this? Do you remember?
Around 2 months into therapy.
Mm.
Yeah.
Mm. And what was it like making this piece in art therapy?
I didn't think I was a very angry person, and then I started doing this piece and I became very agitated and angry while I was making it. But afterwards I felt a lot better.
Mm.
But during it I felt very angry, which is why it's so messy.
And what do you think, what's your feelings about it looking at it now?
I think it's quite nice actually. I don't like the fingerprints around the edge, but I quite like it.
You don't like the fingerprints?
No.
Oh, all right. Why's that?
That was just me stabbing the paper with my fingers to try and get my anger out. But I like the other things. I think it's really nice.
I remember us having some conversations about the fingerprints, and it felt really important for you about almost like you putting your paint fingerprints on the paper was like you grounding yourself as part of your identity when everything else was very difficult for you to ground yourself in life.
Yeah.
Is there anything else you'd like to say about that first piece?
No.
For the second piece is in fact 4 pieces, and you specifically wanted this to be forming one image, didn't you?
Yes.
So what would you like to say about this piece made up of 4 images?
I have always counted my head to be very messy, and therefore I can't access anything, especially about things that my body and brain doesn't want me to think about, and my illness doesn't want me to think about. So I drew this to kind of as a metaphor of what my brain felt like. The first top left picture is just a room where my brain is completely out of control and messy.
Mm-hmm.
My second picture, the bottom left picture, is a safe, a big safe where I keep the things that I don't want to think about, but I can't access it. Then the third picture, top right, is a box being held down by a metal pole and chained to the floor with alarms. And that's the things I don't want to think about or can't think about. And then the bottom right picture is what is in that box and what I need to access in order to get better.
I remember when you did this, you did it quite quickly, didn't you?
Yeah.
They were very spontaneous.
Yeah.
Did that feel important to you?
Yes, I've always described my head as being quite messy, and I've never been able to put it down on paper because it's too messy to even think about. So it felt quite good to finally understand and have a visual representation of what I was feeling.
And at what point did you make these
I made
images?
them 3 months into therapy.
It was about halfway. Did you want to add anything else? What it was like doing it at the time?
It was weird because I'm quite a contradictory person. So I had to think quite carefully about what I was doing so I wouldn't then think, this isn't right, I don't feel like this, but I do still feel like this image is relevant. So it felt quite important to me at the time to get it right, and I think I did.
You said you think these images are still relevant. How are they relevant to you?
I still feel like I have quite a messy head. Not as messy as it was before, but quite messy. And I'm still struggling to access some of the worst memories of my life and some of the best hopes for the future. I'm getting better at breaking into the safe and having moments where I can sort through and open that chest and just relish in feeling positive and knowing that from bad comes good.
Well, what do you think about the piece now that you've made?
I really like it. I like that it's a sequence, and it kind of goes through places. It feels like it's a maze, and it goes through, and I think the colours are quite important to me. The red and the green and the yellow and blue all represent different things.
Mm-hmm.
So the red is like danger and unhappiness, the green is positivity, and the blue and yellow are kind of everything in between.
Could you say a few words about how you are now?
I feel a bit better. I've realised that I need to sort out my head more, and I'm figuring out how I can do that, which is through art. I'm still struggling, but I'm getting there. I have more hope for the future now, and it's given me kind of a new outlook on life, I guess.
Could you say a bit more about what that new outlook is?
I spent a long time thinking that I wanted to die and it was the only way, but now I realise that I owe it to myself to live, and it's actually just my illness telling me that, and I need to be alive basically, and I deserve to be alive. So that's my new outlook.
So in comparisons to other sort of therapies that you've experienced, what else have you tried? What other therapeutic approaches have you tried, and how is art therapy different from those?
I've tried a lot of different therapy. I think I've tried 6 different types of therapy other than art therapy, and most of them are talking therapies. A couple were physical, like hypnosis and pet therapy, but most of them were talking. But art gives me a way to visualise what's going on and make sense of it, because I find it quite hard to make sense of my head, so it helped me to visualise what was going on.
Thanks everyone. So that was the end of the video. I've got here just the references of what I've shared with you today. If anyone wanted to have another look at it or share it with anyone else, I can send them out if anyone wanted a copy of them. So thank you for attending today, and we can go to some questions. I've also put my email there if anyone wanted to ask me anything else, and my website as well for my art practice, which I was referring to earlier. But I'm just going to stop sharing my screen so that I can see you all a little bit easier. 1 minute.
Are you happy for me to stop the recording now?
Oh yes, please. Yeah, so the recording's going to stop now. Thank you, Jess.